Guys, so the MRCS Part B or the Osce of the MRCS examination is about 30 stations, give or take a few. They also have rest stations, so not every single station will be clinical stations. Some will be rest stations. And these stations are very, very helpful because, I mean, it's a very tedious examination and rigorous examination, and so you need some time in between some stations to rest. There are usually two circuits applied, and I think the other one is surgical knowledge or surgical practice. First set of stations in the examination in the applied knowledge would have, it can vary and they can actually have overlap. So I can't remember every single station in my exam, but I will tell you this: they almost always have a Breaking Bad news station and a few history stations. They need to make sure that persons that are taking the examination are able to communicate at the standard in which is required in the United Kingdom. In terms of clinical stations, my exam had about 2 or 3 sets of stations with chest tube insertion and chest tubes in general. Then there was like ATLS. ATLS is like the bread and butter for the exam. You have to know that. You have to know your anatomy inside and out, especially limb anatomy and head and neck anatomy came on my examination. Sometimes they can take it to a whole new level and just ask you all sorts of intra-abdominal organ anatomy, which is common sense because it's a general surgery examination. They can do things where they actually take the cadaver, switch it, and turn it upside down or on its stomach, and this kind of can throw you off a bit because they don't have the head on it. And these are things that I think can be tricky, but it's essential because they want to make sure that you know exactly what it is that they're testing. Quite a few stations, maybe about 8 or 9 stations were stations where they ask you questions and you had to respond. But pretty much every station they ask you questions and you have to respond. Even the history station, they ask you, okay, so what's your differential diagnosis? How would you manage this patient? So that's that. There are about 3 or 4 stations where they have to examine like hernias, do a cardiovascular examination as well as a CNS examination, a spine examination. You know, I think at one point in time they even had a station, I've heard, I should say, where they had a station where it was a hydrocele. I don't know how often they will have that because not everyone will want to have a station where, you know, a bunch of trainee doctors are, you know, examining testicles. Just saying. Just bear in mind that every single station that you do, whether clinical or not, they're going to ask you differential. There's a very good chance they'll ask you differential diagnosis and they'll ask you your management. There's always a telephone station as well too. Telephone station, I did a video on that already, where they ask you that they say your consultant's in theater and a patient is crashing on the ward. What will you do? And it can vary from DVT to compartment syndrome to cardiac pathology. So you just have to keep that in mind. And the examination on a whole, it's doable, but there can be some questions that just come at you that you probably won't know. Just hold your thought process and try to not to let it fluster you, because not every station you'll pass. Try to pass every station, but I'm pretty certain not every station you'll pass. But if you can pass every station, pass it. So for me, the applied knowledge, I think I did way better than the surgical part. Or was it vice versa? I think I posted it on the page, but yes. But for me, I like the clinical stations. Those right. So sorry, this clinical knowledge and applied knowledge. So the clinical stations I find were a little bit better. But the applied knowledge is not so bad. It's just that it can be some of the questions, some of the topics you might not have reviewed until probably like years ago. You might have reviewed it and you probably forgot it. So when they ask you in the exam, you're like, Like, I think lung cancer came from my exam, and I haven't read lung cancer since medical school, and that was over 5 years ago. So just letting you know. And carcinoid syndrome, I haven't read that since I was in internal medicine as an intern. So those are some things that you have to look out for. Just bear in mind that everything is not confined to old exam questions or whatever. So do pass the MRCS, as in the website, and also do the EMRCS if you can afford it, but I prefer the past tests part too, because it has like how the exam really is, and it has like videos and stuff that will tell you how the exam really is going to be. So I hope this helps. Continue to watch my videos. Thanks, guys.